Hi, I'm Dr. Madison. I'm a chiropractor here at Lunt Chiropractic, and we have Tasha here, who is 34 weeks pregnant. I'm certified in the Webster technique, which is targeted toward pregnant patients, so I'm just going to show you kind of what that looks like. So the Webster technique is usually coined toward pregnant patients because it's a very gentle way to adjust the pelvis for optimal function and help with any pain such as low back pain, hip, or sciatic pain. So for Webster technique, we want to look and see where there's tension throughout the pelvis. So to check for tension, I'm going to take the legs here and I'm just going to push up through here a little bit and then see which side has a little bit more tension, which that would be her right side. I'm going to come up here and then check out the glute muscles. So mainly the piriformis muscle, which the sciatic nerve crosses through, can get pretty tight with this. And then I also like to lift the leg and then just do a little internal and external rotation to help release that area. There's also something called the sacrotuberous ligament, which is a ligament that helps to stabilize your SI joint, which is about right up top here. The ligament itself, though, is a little bit lower. It's just medial to the sits bone, and when this gets a lot of tension, it can cause a little SI dysfunction up top and allow those tightened glute muscles to pull the SI across, causing more low back pain and sometimes that sciatic pain. So to get to this, I'm just going to go on the inside of your sits bone right here, and I'm just going to be kind of pressing up. Feel okay with that? It's like not the most comfortable thing in the world. Good, just until I feel the tension release a little. And then I go through, I like to do a little bit of traction for the low back. All right. And then the adjustment itself is using the drop table. So to adjust the sacrum, I'm just gonna press down through here and just like that. And because it's a very gentle adjustment, typically you have to do it a couple of times in the area. Good, just to get a little bit of additional flexion through there. Okay, and then I'm gonna have the patient rotate onto their back. I'm gonna stretch her hip flexor, or mainly her psoas muscle next. So this muscle attaches deep into the back and then comes forward and crosses the hip and can get really tight. So I'm just gonna kind of fan your leg out a little bit. We're just gonna stretch this way. Doing okay? And then lastly, what I want to check is her pubic symphysis. So a lot of times this can become a little unlevel with the adductors attaching and kind of pulling down and stabilizing that pelvis while it's starting to open and change a little. So I'm just going to palpate your pubic bone. Good. Do you mind raising this other leg for me too? Okay. It can be very sensitive too, so you don't want to palpate too hard. And then either gentle vibration, or usually we would use an activator to help adjust this. So it's a great way to make things more comfortable for mom, and then also helps to decrease things like labor time and make the overall experience more comfortable.